Hi, hello friends, good morning to everyone. Welcome to our channel, The Voice of Nurse. Today we are going to discuss a continuous topic from the previous class, very important topic, blood pressure and venous pressure. In today's class, previously we discussed in previous last class blood pressure. Today we are going to discuss continuous topic from the blood pressure about venous pressure and pulse pressure. In today's class we are going to discuss what is venous pressure and what is pulse pressure and what is the difference between blood pressure and venous pressure, and also what is the difference between the blood pressure and pulse pressure. Actually we have to discuss in last class only. Briefly I explained regarding blood pressure in the previous class. Too long and too lengthy between the three topics in the one class. That's why I am making three topics in two classes. So today we are going to discuss blood pressure, about what is venous pressure and what is the difference between blood pressure and venous pressure, and pulse pressure also we are going to discuss in today's class. So before moving on to today's class about venous pressure and pulse pressure, a small request friends, anybody here new to this channel, please subscribe my channel, click on the bell icon for further notification, and please share the video to your friends. And our content is useful to anyone, give a like and share your opinion comment section. Let's move on to today's topic, venous pressure and pulse pressure. Today in class what we are going to discuss, briefly we will see index. Venous pressure, related to the venous pressure we are going to discuss what is CVP, what is VP, factors affecting CVP, CVL insertion, what is normal CVP, differences between the VP and BP. VP means venous pressure, BP means blood pressure, CVP means central venous pressure, and also continuously third topic we are going to discuss pulse pressure. What is pulse pressure, what is the relationship between the blood pressure and pulse pressure, how to calculate the pulse pressure, role of nurse in blood pressure monitoring, and CVP pulse pressure. These all things we are going to discuss in today's class. About blood pressure topic we already discussed in previous class. I will give a link in description. Please, anybody not seen, please check it once. I will give link in description. Now first we will see venous pressure. What is venous pressure we will see. What is CVP? CVP is the pressure within superior vena cava or the right atrium to provide information about the blood volume status and right ventricular function. CVP means central venous pressure. Central venous pressure. CVP is the pressure within superior vena cava or right atrium to provide information about the blood volume status and right ventricular function. CVP will provide us what is the information about blood volume status and what is the function of right ventricular. Will provide the CVP. CVP means central venous pressure. CVP means central venous pressure. CVL means central venous line. CVP means central venous pressure. CVL means central venous line. CVP can be used as an estimation of preload and right atrial pressure. Central venous pressure is often used as an assessment of hemodynamic status, particularly in the intensive care units, means ICUs. CVP is important means CVP, central venous pressure, is an estimate of right atrial pressure, has been used to assess the cardiac preload and volume status in critically ill patients, assist the diagnosis of right-sided heart failure and guide fluid resuscitation. It is determined by the interaction between the cardiac function and venous return. CVP is considered a direct measurement of blood pressure in the right atrium and vena cava. CVP is considered a direct measurement of pressure in the vena cava, can be used to estimation of preload and right atrial pressure. In case Elevated CVP means what will happen means in case elevated CVP is associated with increased risk of mortality, and AKI means acute kidney infection in critically ill adult patients admitted into the intensive care units. Here what is CVP and what is VP? What is CVP means here central venous pressure. What is VP means venous pressure. Here, CVP is considered a direct measurement of blood pressure in the right atrium and vena cava. Just now we discussed. No need of discussion about CVP here. Next, we will see what is VP. VP means venous pressure. VP means venous pressure. Venous pressure is a term that represents average blood pressure within the venous compartment. Venous pressure, the term that represents the average blood pressure within the compartment of the area of the venous compartment is called as venous pressure. But CVP means the measurement of BP in the right atrium and vena cava is called as central venous pressure. Why it is called as central venous pressure means venous pressure is term that represents the average blood pressure within the venous compartment. So the CVP termed as describes the pressure into the thoracic vena cava near the right atrium. So this is called as CVP. CVP means the pressure in the thoracic vena cava near the right atrium is called as CVP. Next we will see the CVL insertion means CVL means here central venous line. Central venous line insertion. What is central venous line insertion means a central venous catheter is a thin flexible tube that is inserted into a vein usually below the right collarbone and guided into the large vein above the right side of the heart is called as superior vena cava. It is used to give intravenous fluids, blood transfusion, chemotherapy and other drugs also. There are three main access sites for the placement of central venous catheters. Those are internal jugular vein, common femoral vein and subclavian veins. These are the preferred sites for the temporary prominent venous catheter placement. For the CVL insertion equipment, patient position, procedure after insertion, protocols is the very important. We will see equipment. 99% of cases the central venous catheters are HD sheaths and also peritoneal dialysis sheaths, most commonly under the guidance of ultrasound only doctors will do. We will see the equipments first. Equipments: ultrasound machine with high frequency liner transducer, sterile products, mask, head covering, the inducer kit with the central venous catheter, lidocaine, various sterile syringes, gloves, sterile saline flushes in 10 cc syringes and sterile occlusive dressing and biopatch and etc. Coming to patient position. Trendelenburg position is the position for the patient on the operating table, most commonly used during the lower abdominal surgery and central venous catheter placement. Trendelenburg position means the patient is supine on the table with their head declined below their feet at the angle of roughly 16 degrees angle. Already we discussed first only in CVL line insertion. Next, after the insertion protocols. Once the catheter is fully inserted, the guide wire can be gently pulled through the distal port, usually brown. Using a syringe, aspirate blood, remove air from each port and flush with sterile saline solution. Means lure locks may be attached to the end of each port either before or after the step. After the central line insertion, assess for signs and symptoms of infection and ongoing need for the central lines on daily basis. Take further actions for the signs and symptoms of the infection, and also after the insertion of the central line, anything means more than one prick means some cases patient will get a hematoma. So role of nurse also very important in the CVP line. Have to assess signs and symptoms of the infection and daily basis also very important. And also hematoma, monitor the hematoma or any bleeding from the area, previous pricked area also we have to check. Procedure, equipments, patient position and after insertion of the CVP line. Next we will see the factors affecting central venous pressure. Factors affecting the central venous pressure depending on the cardiac output and venous return. It is pressure within the intrathoracic vena cava and approximates right atrial pressure. It is influenced by the blood volume, vascular tone, heart rate and ventricular contractility. Here factors affecting central venous pressure line comes under the cardiac output. First one is, second one respiratory activity, blood volume, third one is, fourth one is contraction of skeletal muscles, fifth one is intrathoracic pressure and sixth one is gravity. Along with these we are having other factors also. Cardiac tamponade, decreased cardiac output as already seen in first one. Next, forced exhalation, heart failure, hyperolemia, mechanical ventilation and application of positive and expiratory pressure means PEEP, pleural effusion, pulmonary embolism. These all things comes under the factors affecting the CVP line. What are the causes and increases the CVP line means? A decrease in cardiac output either due to the decreased heart rate or stroke volume. Example, ventricular failure results in blood backing up onto the venous circulation is increased venous volume. Less blood is pumped into the arterial circulation. The resultant increased thoracic blood pressure or blood volume increases the automatically CVP. Next we will see what is normal central venous pressure. The central venous pressure is assessment of venous return blood volume and indirectly of cardiac output. The normal CVP is between the 0 to 8 mm of Hg or 3 to 8 centimeters in water. Here if it is less means what happened? If it is more than this value 0 to 8 mm of Hg means what will happen we will see now. When we called hypovolemia and hypervolemia, now we will see. If it is less means it is called as hypovolemia. In case it is more than 0 to 8 mm of Hg, more than 8 means it is called as hyperolemia. Some factors that can decrease central venous pressure or hypovolemia are also hypovolemia, also called as venodilation. Either of these would decreases the venous return and thus decrease the central venous pressure. A decrease in central venous pressure is noted when there is more than 10% of blood loss or shift of blood volume. Hypovolemia indicates means the assessment of venous return blood volume and indirectly cardiac output. The normal is value 0.8. In case of less than value is called as means 0 itself, less than 0. Normally 0 is the normal. Actually 0 to 8 is the normal, but less than means 0 is called as hypovolemia. In case of hyperolemia, our results indicates elevated CVP is a consequence of training induced hyperolemia without alternation in total effective venous capacity. Elevated CVP is indicative for myocardial contractile dysfunction or fluid retention. On other hand, low central venous pressure is inadequate volume of duplication or decreased venous tone. This is related to the normal value of CVP and hypovolemia and hyperolemia. Next we will see, does venous pressure affect blood pressure or not? What is relationship between the venous pressure and blood pressure? What is the difference between the venous pressure and arterial blood pressure? Means arterial pressure we will see now. First one, does venous pressure affect blood pressure or not? Inadequate skeletal muscle pump, venous pulling may lead to the extravascular edema, reduced blood volume and limited venous return to the heart. Limiting venous return leads to reduced cardiac output and mean arterial blood pressure. So, Does venous pressure affect the blood pressure? Means inadequate blood pressure means inadequate venous pressure will cause the skeletal muscle pump. Venous pooling may lead to the extravascular edema. So thus venous pressure will affect the blood pressure. We will see what is relationship between the venous pressure and blood pressure. The increase in the blood volume raised mean systemic pressure and shifted the venous return curve to the right in a parallel manner. The each level of right atrial pressure, the rate venous return was greater to higher level of mean systemic pressure due to the greater pressure gradient for the venous return. What is the relationship between the venous pressure and blood pressure? Means increases the blood volume raised mean by systemic pressure shifted into the venous return curve and into the right in the parallel manner. Then each level of right atrial pressure will rate venous return was greater at higher levels of mean systemic pressure. Due to the greater pressure will comes under the venous return automatically. Next we will see the what is the difference between the venous pressure and arterial pressure. The differences between the blood pressure and venous pressure means blood pressure in the arteries is much higher than the veins, in part due to the receiving blood from the heart after the contraction, but also due to their contractile capacity. The tuna media of arteries is thickened compared to the veins with smoother muscle fibers and elastic tissues. This is related to the differences between the venous pressure and arterial pressure. Why arterial pressure is higher than venous pressure each and every time? Means why arterial pressure will high comparing to the venous pressure. Generally blood pressure decreases from the arteries to veins. This is because of the pressure overcoming the resistance of the vessels. The greater the change resistance at the any point of the vasculature and greater than the lost pressure at the that point. That's why arterial pressure is high comparing to the venous pressure. This is the differences between the venous pressure and arterial pressure. And does venous pressure affect the blood pressure? Means as what is the relationship between the venous pressure and blood pressure? And arterial pressure is higher than the venous pressure. Why? This is related to the venous pressure. Second topic is venous pressure. First topic is blood pressure. Third topic is pulse pressure. Now we discuss related to the venous pressure. What is CVP? What is VP? Factors affecting CVP, CVP line insertion, and what is normal CVP? Differences between the VP and BP means venous pressure and blood pressure. This is related to the venous pressure. Now we will discuss third topic is pulse pressure. Now we will discuss about third topic pulse pressure. What is pulse pressure? What is the relationship between the blood pressure and pulse pressure? How to calculate pulse pressure and role of nurse in blood pressure and CVP already discussed, blood pressure also discussed. Now we will see the pulse pressure. About pulse pressure we are discussing very briefly. Why? Because of we all know related to the pulse pressure. That's why I am explaining very briefly. Pulse pressure is the differences between the upper and lower number of the blood pressure. Upper and lower number of in between the difference is called as pulse pressure. This number can be indicator of health problems before you develop some symptoms. A resting pulse rate of 120 beats per minute in adults would be considered high, while a heart rate between the 60 beats per minute and 100 beats per minute is normal for the people 15 years and older. The pulse rate, also called as heart rate, is the number of times the heart beats for the minute is called as heartbeat. Your pulse can be felt on your wrist. This is about the normal pulse rate. Pulse pressure is differences between the systolic and diastolic pressure. Just now I said, for example, in case the systolic blood pressure is 120 mm of Hg and diastolic pressure is 80 mm of Hg, means totally 120 by 80 mm of Hg. Then pulse pressure would come 40 mm of Hg. The differences between the systolic and diastolic blood pressure is called as pulse. So here 120 mm of Hg by 80 mm of Hg. The value pressure would be 40 mm of Hg. What is relationship between the blood pressure and pulse rate? The relationship between the heart rate and blood pressure is location dependent. As discussed above, there is a direct relation between the heart rate and peripheral blood pressure. However, a number of studies have demonstrated inverse relationship between the heart rate and central blood pressures. In case the client heart rate is elevated, automatically blood pressure will high. So, elevated heart rate is associated with the elevated blood pressure. Increased risk for hypertension, and among the hypertensives, increased risk of cardiovascular diseases also. So, high blood pressure can cause the heart to thicken, which could affect the electrical system and result in a lower pulse. The heart rate, also called as pulse, nothing but heart rate is also called as pulse, measures how many times per minute heart beats, which means how many times our heart will beat, that is called as pulse. Blood pressure measures the how strongly your heart and blood vessels pump blood into the rest of the body. This is the relationship between the blood pressure and pulse. Now we will see the how to calculate the pulse pressure. The top number is called as systolic, bottom number is called as diastolic. The systolic and diastolic is the pulse pressure. For example, just now I said 120 by 80 mm of Hg is the blood pressure. The medium value was 40. Consider as healthy pulse pressure. Calculate the pulse pressure. All you have to do is subtract the bottom number from the top number. Subtract the bottom number from the top number means bottom number means diastolic, top number means systolic. We have to subtract the bottom number from the top number means, for example, just now I said the blood pressure BP was 120 by 80 mm of Hg. That would be, we have to subtract bottom number to top number means diastolic to systolic. So here we have to do minus. So subtraction 120 minus 80 equal to 40. We will get a answer correctly. 80 is the pulse pressure. This is the calculating pulse pressure, formula for the calculation of pulse pressure. Depending upon the pulse calculation or the pulse rate, how your heart is working or not, we can know. Finally, the role of nurse. Nurses are responsible for taking vital signs regularly, ensuring they can respond quickly if there is an emergency or change in the patient's condition. Not only pulse, vital signs means we are having all vital signs: temperature, pulse, respiration and blood pressure. These all things comes under the vital signs. The nurse should place the index, middle and ring finger over the radial artery, which is located above the wrist joint on the anterior surface of the thumb side of the wrist. Apply gentle pressure to avoid obstructing the patient's blood flow. The rate, rhythm, strength and tension of the pulse should be noted. This is pulse. So this is the role of nurse in the monitoring of pulse. To take vital signs, nurses will use blood pressure cuffs and thermometers to measure the pulse rate and temperature. This is the main role of the nurse in monitoring the vital signs. This is related to the pulse pressure. Till now we discussed pulse pressure, and previously from the starting we discussed venous pressure in today's class. In previous class we discussed about blood pressure. Totally 3 topics we discussed in the nursing point of view: blood pressure, venous pressure and pulse pressure. Anybody not seen that blood pressure topic, I will give a link in description. Please check it once. Blood pressure and venous pressure. Along with blood pressure and venous pressure we discussed pulse pressure also. Thank you so much for watching the video. Anybody here new to this channel, please subscribe my channel, click on the bell icon for further notification, and please share the video to your friends. And content was nice means give a like and Please share your opinion in comment section. Thank you so much. Keep watching friends. Stay tuned. Thank you.